Hello there. My name is Jonathan Friedman, and you are listening to FAQs by EHN Canada. This is the show where we scour the internet for the most frequently asked questions about mental health and addiction and ask an expert for their answers to them. Today, it is my honor and my distinct pleasure to introduce to you Christina McNeill. They are the Manager of Clinical Services for Acclaim Ability Management. She specifically manages a program called the Mental Health Ecosystem. I want to know more about that soon, which is an innovative and strategic mental health initiative. This program is close to her heart, a passion project of sorts, which optimizes mental health and substance abuse treatment through a collaborative, multidisciplinary approach that targets individual treatment goals with intensive collaboration with mental health experts across Canada. Christina completed a master's degree in counseling psychology and holds substance use, relational psychotherapy, and expressive arts psychotherapy certifications. She's also a trained kinesiologist, which has been critical for her work in disability management. She believes in authentically showing up in any space we occupy and listening to our genuine selves in all aspects of our lives. Christina, what a resume. Welcome to the show.
Thank you so much, Jonathan. It's great to be here and talking to you today.
I feel the same way. Before we get into the 5 big questions, we have lots to cover today, but I really want to know straight from the source of all the spaces in the world. How did you get into disability management, into this mental health ecosystem? Give the listeners a bit of a sense of your journey.
Well, it's kind of a funny story, actually. So funny that you should ask. I did have a lot of different experiences that you shared. Thanks for that. What a great introduction. I feel like I don't have to repeat much. But really, my career has taken many different turns, twists and turns, and I'm like a sponge. I wanted to absorb as much information as possible from many different sources. So I did jump around, worked in different cities, and tried to see what really stuck. And I have a lot of different interests, as you could see, a lot of different places that my heart lies. But I found that I can only do so much in my previous roles, and I can only have an impact on one person. So it was actually after the pandemic that I was looking for a change. And with my varied resume, as you shared, lots of different experiences in different fields, I thought I would look for something that I could combine all my interests in and kind of see what was out there. So I explored Acclaim. I applied to a role there, far from the role that I'm doing now. And very quickly, it became evident that there's more that we could do. And Acclaim has been great that anytime that we have something that could benefit the employees and the employers that we service and the communities that we work in, they're open to exploring it. So we got together, we created this program, the Mental Health Ecosystem, and it's a strategic initiative. And that's how I ended up here, was combining my physical health side with the mental health side, and all of the disability management knowledge that I have. So it's a perfect place for me because I can use all my different experiences, all my different strategies, my pain points with the systems. We can all groan about the healthcare system and lack of access to care. And there's different ways that we can actually impact that with in the private world and in structures and systems and specific interventions. So that's why I'm happy to be here in this space. And I think that it's definitely, there's more to come. There's more that we can do, but I'm very excited to be talking to you today and just sharing my 2 cents on my experiences, the information that I've gleaned working in this field in disability management and trying to help like-minded individuals get back to work and feeling confident and capable when they're going back to work. So yeah, very, very excited to be here.
Amazing. And thank you so much for sharing that. That's really, really interesting. And we didn't cover all of that in that initial intro. So thanks for all.
My pleasure.
I think this is an interesting topic today. We're going to be talking about returning to work after treatment. And I think that we talk a lot about, still not enough, but more and more we're talking about, mental health, addiction, what going into treatment looks like. But I feel like a really untapped conversation is transitioning out of treatment. What do all of those different steps after look like? What do those transitions look like? So after lots and lots of research, the first question we came up with was, what are the key challenges faced when returning to work after treatment?
That's a fair question because I think, if I'm putting myself in the shoes of going to treatment and then, okay, what's after? Whether it's an inpatient treatment, outpatient, if I'm removed from my life, if I'm still physically in my world, in my home, there's just so many moving parts that it's important to kind of have a list. Like I think that's important to identify, where do I start? What's the, what are the key principles? Um, it might be helpful to mention that, when you're in treatment or either individual, group treatment, residential, like I said, we're with like-minded individuals. If I'm seeing a therapist, they're on the same page. They're supporting my mental health journey. They're supporting me setting boundaries, knowing myself and getting to know myself deeper. And that reflection, they're really interested in my own self-reflection and what I'm seeing. But when we go back to work, it's no longer that environment. So I often talk about when we're in treatment, it's more of a protective environment or a petri dish environment. My science people out there, um, you know, it- we go into reality and it's completely different when we go back to work, when we start talking about going back to work. So um, first thing is imagining what that could look like. If we're not imagining it, if we can't see it, how is it going to be real? How are we actually going to respond in the moment? So I like to use the analogy of the sports psychology because my undergrad's in kinesiology. So I use sports references a lot more than I probably should. But, in sports psychology, we have, a ski jumper that is visualizing going down that ski jump over and over again. And they're picturing everything that could go right, everything that could go wrong, and walking themselves through it. We don't do that when it comes to exiting treatment and return to work. It's just, okay, what's the next step? What is my discharge plan? And who do I need to share that discharge plan with, right? So it's really important to have that plan or structure. So if we're asking about the key challenges, a lack of plan or structure, lack of practice are probably at the forefront of my mind. Other things are, what if an individual is going back too fast? Like, what is the speed of return to work? Are we doing it too fast? Are we doing it too slow? Have we been off work for a long time? Um, so if we're off work for a long time, that would lend itself to now there's a higher threshold or a higher ante. We've upped the ante, we've upped the risk. It's this big unknown thing. How do I even imagine to go back there? Well, a plan really helps, and discussing that plan is really key. If we don't have the discussion, if we don't have the forethought, we probably aren't going to be very successful. If we go back too fast, so I've been off work for some time, or I'm trying to reintegrate to my full duties. If we just go, the black and white, I'm off work and then I'm back at work. How is that going to be helpful for anyone? How is that going to be helpful for us? Where does that leave room for strategies to be implemented, for treatment to be adjusted as we're off work? So um, we always suggest, a gradual return to work or a modified return to work. So increasing duties slowly or increasing hours slowly to get back to our full capacity. It allows us to adjust to what's working, what's not working, go back to therapy or set new boundaries. Or, sometimes we establish that maybe this isn't the line of work for me, or that, I don't want to be in a supervisory role. I really enjoyed being frontline and engaging with individuals, and that's where I get my energy from. So it allows us to still check in with ourselves, be our authentic self, show up with our true energy, and then adjust to what we want our workplace to look like, what we want our work selves to look like. And then the too slow, going back too fast, we talked about the too slow before I forget to go back there. If I have a long term return to work plan, so let's say I'm returning to work for 8 weeks or 3 months, and I'm slowly increasing hours, it is hard to get back full time. So if we go too slow, the momentum's not there, that we're not advancing, or we lose our motivation to return to full duty. So it's also helpful and protective for us to return to work in a timely fashion. Um, so are you going to say something? I went to
No,
talk over you.
no. This is your show, Christina. That's awesome. Um, that's really, really interesting. And one of the questions that comes up for me, not one of the official five, but like sort of another question is that, like, what are some of the triggers? What are some of the things that can happen at work that sort of indicate that maybe somebody is coming in too fast? Maybe we're moving a little slowly. What are the things we should be noticing?
Right. So in the identity portion, the things that would be triggering would be if I feel like I'm becoming self-critical, if I feel high levels of anxiety, so I'm stressed going into work. I'm things that we hear a lot in the field is I'm sitting in my car and I'm going over my day before going into the office, and I just can't open that door to get out of my car, like ruminating, hyperfixating, and high levels of stress. Sometimes that's part of the therapy, that's part of the treatment that we need to overcome that barrier and go into work. But when it exceeds a level that we can no longer function or are probably the term that I like to use is outside of our window of tolerance. So is it something that I can manage? Or is it something that, wow, I'm really outside of my norm and outside of my comfort, and I don't know how to even take the next step forward? So these, I mean, they're not concrete things, but they're things that we will notice, especially after going to treatment when we're acting outside of our usual selves or the things that make us feel comfortable and safe or safe enough, because we don't always want to be safe. We want to be safe enough in therapy, safe enough at work.
Yeah, we want to
Um,
increase the window of tolerance.
Yes, exactly. We want to increase that. So if we're not stressing ourselves or taking risks interpersonally or at work slightly each day, we will constrict. We want to keep stretching that. We want to keep growing into ourselves. And the more, I mean, I'm going to get a little psychological here, but the more that we give our brain the evidence that we can succeed, we can do hard things. I now have a positive outcome going into work when I'm scared or when I'm not feeling my full self, and the day goes fine, or I can do it, the more our brain wants to do that. Um, I was speaking with a psychiatrist recently in consulting on a few different files. And he was saying, you know, it's so funny because the treatment for anxiety is actually the fact that we need to be exposed to the environment or the situation that scares us. But which of us wants to do that? Which of us wants to take that risk? And that's why that support in doing so is so key. So getting that proper treatment with appropriate individuals is best. Um, some other things that we might notice that would be triggers, or sometimes I don't like that word because of its connotation. It's changing
Fair
its
enough.
language a
Yeah.
little bit. But the things that might be you know, yellow flags or red flags to things not going so well might be, you know, we're no longer doing our activities of daily living that we need to do, or activities that we enjoy. So that's, you know, one of the key um, factors in diagnosing depression. Like, is there a loss in pleasurable activities? Am I able to do the things that I once did? Am I able to, do I want to pick up the phone even and call a friend or have family over or say hi to my neighbor when I get home? What is that shrinking, as you said it? I love that term, that shrinking or that expansion. What does that look like? Is this outside of my norm? These would always be warning signs if we're no longer doing the things that we did before when we felt our most emotionally well, right? Back to our own baseline, not comparing against our neighbor, not comparing against our colleague at work. For however social they are, for however active they are, it's really important just to compare to myself, right? What is my norm? What do I want? And getting back to that authentic self. I'm going to keep saying that.
That. So, okay, so you're back at work, you're starting to maybe experience some things that you're calling yellow, red, orange flags, things that are indicating to you that something is uncomfortable in these moments. What are, like, what role does ongoing therapy or maybe different supports in the workplace, what role do those structures play in return to work?
So you're at work and you're struggling, or just even when you're not struggling? What do you?
Yep, could be both. Like, we're returning to work, what role does ongoing therapy play in that?
Okay. Well, I think that as these situations are arising, those yellow, those red flags, it's always important to kind of call in the cavalry. Cavalry. Sorry, that was hard to say. Call in the cavalry. So, you know, what is our support system? What was our discharge plan from treatment? One of the biggest barriers to being discharged from treatment and actually feeling better long term is that there is no continuity of care. We need that continuity of care. So I'm going to say the same thing here in terms of ongoing therapy or ongoing treatment. We could just call it. It doesn't have to necessarily be rigid psychotherapy. It could be a lot of different options combined together. But I think that, we've discussed strategies while we've been off work on what we should be doing, but what happens in real life, right? There's always going to be outliers. There's always going to be situations that we need to pivot or we need to adapt in the real moment, adapt ourselves, adapt our thinking, have flexibility around our treatment plan and coping strategies. And how do I stay consistent and stable within that environment, right? How do I keep my peace? How do I keep my joy in that and maintain myself? Well, I need to go back to those treatment providers. I need a second set of eyes. So that's where that is so imperative to ongoing and sustained recovery. And also if we're doing well, like if we continue to do well, we don't really have those yellow flags. We don't really have those red flags. It's all green all around. So how do I prevent it from going to the yellow or red? Well, I maintain that support. In the psychotherapy world, we call it maintenance therapy sessions, right? It just means it's a checking in. It doesn't mean that anything's going wrong. It means that I can talk about the things that are going right and check in with how my self-care, how my coping, how my life is going with the things that I am doing. I do think too, going off work and taking that break to engage in treatment, we often, when we're removed from that environment, we are identifying the limits and boundaries that didn't exist before. We're seeing where those red and yellow flags are. We're seeing those gaps in our support plan or everyone's heard of self-care, but self-care to a bigger degree, the gaps in how to help ourselves through treatment, through structures in our life, through coping strategies, through enjoyable activities. We see where maybe we missed the mark on that, right? And we try to fill in those gaps and create that as part of our recovery plan. I think too in therapy, it's, depending on the type of therapy, and I'm going off on a bit of a tangent here, but it's really important for that ongoing therapy to also acknowledge that there's a biopsychosocial component to any mental health or substance use illness, right? So what biologically is going on? What can I do biologically? Can I exercise more? Can I get outside more and get fresh air more? Do I need to connect with a circle of friends? Do I need to join community activity to get that social support? And what kind of psychological supports do I need? Have I been getting that support from individuals in my life, from professionals, from maybe medical treatment, just to really keep monitoring the progress and monitoring the emerging needs. I also think it's important to acknowledge that not everyone has been through the same type of mental health treatment and support. Mental health language is still jargon. Not everyone has gone through, well, I won't name off a bunch of therapies, but I'll save you the time. But, not everyone has gone through the different types of treatment and has been educated with the same type of psychoeducation. So if I'm going into a workplace and I'm expecting something because I know that's what's good and healthy and positive for everyone around me, not everyone's on the same page. So how do I adapt to that? How do I maintain my boundaries, myself, without getting absorbed into maybe some other problematic behaviors or even just conversations or language that might not be helpful for me? And so to stabilize, to stay on my path in my recovery, that's why it's so important to maintain those ongoing supports and those that are clinically trained and evidence-based, right? I'm going to keep saying that because I can't emphasize it enough. Yeah, it is very important. And we want to know that the treatment that we're getting, it's not just treatment, it's treatment that's effective for us, that's the appropriate method, appropriate timing. So there's so many specifics to the type of therapy that I think when we talk about ongoing therapy, there's also ongoing therapy / assessment, right? We always want to make sure that we're being monitored for what's coming up in our lives. If I go through something that wouldn't be foreseen, like a shocking loss of someone close to me in my life during this process or down the road, how am I going to manage that if I don't have that support network set up before I feel like I'm slipping back into old patterns, before I feel like I'm going into a deep depression? when I'm in there is not the time to be setting up those supports. I need them to be prepared. So ongoing therapy is the way to do that.
Totally. And just from my own personal experience, like I was running a company for a while, and the company finished. And I took a few months off to sort of figure out what my next steps were. And I've been accessing therapy my whole life. And I'm a very socially anxious person slash podcast host, the perfect exposure. Uh, and so during this time, I'm having my normal CBT, but during that time, like, I start to become very depressed from like, I was an entrepreneur, like what, but stability is important. Okay, I want to work in a more stable working environment. I'm going to come to some kind of corporate environment. I didn't know what it was yet. And I felt that like loss of identity. I'm a wily, creative, entrepreneurial person, and I felt like leaving the company is going to cause that. And this like spiraled for me into a bit of a crisis, and I was very distressed. And my therapist, like, I had a session, and he saw like something different, and he took a step back. We went through an assessment, and he started to build in DBT skills in, because those were really, really important. And then when I started going back to work, next season of What's Going On, it was more coachy and CBTE again. And I think having the flexibility to, like, as a clinician, to go back and look at all those different tools in a toolbox and see, that this person, this client, this patient is in front of you, and they're going through all sorts of different things, and we need to apply these different evidence-based skills to bring them to that next season. I think it's really, really, really important.
Yeah, I thank you for sharing that. I really appreciate that. And kudos to you for being in the experiment of challenging yourself to the exposure. I think, yeah, it's really important to have that ongoing relationship. Somebody that knows you, somebody that you're trusting, somebody that can actually say these things worked or didn't work for you, or I'm seeing new symptoms, or hey, Jonathan, this is what we talked about 2 years ago. This is all that you're facing, and I wonder if you can use the same strategies here. It's nice when you can move on to that stage, like you said, and it's somebody that you can just um, shift that treatment plan with, or rely on for appropriate support when you need it. And like it sounds to me that you actually trusted their support, you trusted their input, and you were totally on board with changing the therapy option for something that might help you at that time. I think that's really important. Yeah.
I think that trust is like important too, and like, I feel like in this conversation of return to work and all of these different support structures, having your clinicians, having, like, your team at work, having all of those different people. It's really about having those trusted relationships, to know that, okay, you're walking into work. I don't feel good today. Something is off. The red flags are showing up. Who am I going to go to? What supports am I going to access? So I think as the individual returning to work, knowing who to access is really important, and how to access them. But also as the team around, like, somebody not doing something or doing something differently, you might not have visibility into why that person wasn't at work and is now at work. But knowing something is different is really important, and being able to create that trust to have the conversation, or to direct somebody to the proper conversation, is really, really important. So for me, I'm really curious what your thoughts are on, as somebody returning to work, like, how do you effectively communicate something to maybe your boss, or a teammate, that, those red flags or orange flags are showing up, or maybe I just need to create a boundary or take a break today? What does that look like?
That's a great question. And something I wish I had a platform to speak with others more about. So this is great that we're having this open and honest call today, or this discussion today. That I always I was told once, but I always see disability management and taking care of ourselves, or taking time off work, as a communication science. Like, it's so important to have open communication. And open communication doesn't mean that everyone's always receptive to what we say, or can always find the answer um, to resolve our issue. But it means that the parties are willing to come to the table and create the supports or set up those supports or direct me to where I might find those supports. I know that I have an ear if I need it. I know that I have a shoulder that I can lean on if I'm not able to get those supports myself. So I think that in communicating our needs and setting up supports, it's really, again, it's that tricky disability management perspective, which is we are at the same time, all at once, combining the communication or connecting the communication between and the thoughts and feelings and fears between the employee, the employer, the disability manager, and the treatment providers. So having everyone come to the table, having that connection, that communication, and a meeting where all stakeholders, all parties are involved and on the same page, that is key to communication. So just the structure of communicating, setting up those meetings, that's really imperative to making sure that we're successful returning to work. And having someone like a mediator or a disability manager that can help communicate that effectively and in a confidential manner where we're not disclosing personal health information. What we do instead is that we focus on sharing abilities rather than disabilities. So what can this person do? So I'm going to use myself as an example. Christina performs best when she has direct written instructions and if verbal meetings are followed by an email summary, right? So that says on my end, when I'm looking at that probably that individual doesn't do well hearing things and following orders. They need to have it written down. So maybe they have symptoms of ADHD or anxiety where they're not totally present in that moment when they're talking, or social anxiety, and they need it communicated in another format, right? It's just about accessibility, basically. Or another example of abilities versus disabilities is that Rose finds it helpful to have a clear outline of job expectations to be most effective and efficient. So what that means too is that when Rose begins to spiral, how can she come back to her core job duties and know that what she needs to be doing? If we're talking about, who do we lean on and how do we have those supports and how do we communicate with those supports, I think it's important to, again, have those set up beforehand, right? Plan of crisis is not effective when we're in the crisis. We need to know the plan before. We need to be reviewing it. We need to be exploring it and seeing how we can amplify it before the crisis happens. So it's really important to have good policies around, workplace supports, around benefits and ways to access those benefits. And also it's really important for abilities and wellness partners or HR professionals is another word. It's really important to have those individuals in the workplace that are knowledgeable or are open to obtain or find the knowledge that's out there and connect the employee to that knowledge. So not everyone's going to be as comfortable with, different colleagues or managers or supervisors or leadership as others. We're going to have our people that we are more comfortable with, and maybe we can identify those individuals for ourselves before returning to work. So who do I feel comfortable with? What can I ask them? And before I even go back to work, and I know that this is often asked in job interviews, more in this day and age, is, how do others know when I'm not doing well? Because they might think it's normal, they might think it's an off day, but for me, that's a huge warning sign. So how do they know when to amplify the plan, amplify the support, and assist me when I need it? And I think that is very individual. That is something that we need to communicate. And again, in a confidential manner, in an abilities rather than disabilities manner. So this is when I'm doing well. Like, let's promote the positive. Let's talk about the good things. And when you know that I'm doing well. So anything outside of that, and I won't disclose what those things look like, that this isn't my norm. Right. And that's all reliant on all the parties being flexible, being open-minded, and being receptive to hearing and caring about their employees. So that's why that's so important to pull in those external providers when we can, or a disability management consultant to make sure that we can have those effective conversations. Or maybe it's a union steward. Maybe it's somebody from a union that can come and be my support and communicate in the language that my employer needs to hear that, or that, follows disability management practices.
I think for everyone listening, even if you're not specifically a disability manager, but let's say you're you're a new manager or you're a leader in a company, I think that idea of focusing on like having that strengths based approach is really, really something we can all learn from this. Rather than saying, I'm not giving that project to that guy because like he's not good at XYZ. Saying, well, that person's really great at XYZ, so why not hand this one, or this person might not be able to focus and doesn't take orders well. They could be really great creative thinkers and able to solve problems individually. So taking that away and taking the time to think about who on your team is good at things rather than not good at things is probably very, very effective.
Right. And supporting and relying on the team's abilities and their interests. Like that's how we create highly functioning teams. Everyone feels part of the team, integrated in the team. Everyone feels like they have a part or a special role. That's what that we definitely can find. In terms of communication and disability management, I wanted to just reiterate about the siloing. So, I return to work and here's my manager and here's my team. But it's a whole structure. There's a whole team of supports in my world. And it's really important to have somebody to connect all those parts that is knowledgeable in mental health. And that person should not be my therapist, should not be my psychiatrist or psychologist, because that's disclosing personal health information. However, if it could be somebody that can effectively communicate in the disability management field, so can effectively communicate my abilities and what's recommended for me in a confidential way, and connect all the programs and all the resources, including amplifying supports as needed. I think that's really imperative and important, and that's actually what I do with my team and in our program, the mental health ecosystem. So it's difficult to combine all of these programs and these perspectives if you haven't had the experience in those settings, right? So I'm working in a high tech company. How do I know how to support my employee with mental health? Sure, I may have HR training and they might have specific lunch and learns, but I'm not effective at doing that. So that's why it's nice to have that one person when there are many parties that need to be communicating well, and maybe there hasn't been historical effective communication and support set up in the workplace, especially a new manager or a new employee or a new organization. Like you said, maybe it's a startup, and they just don't have these practices, and it is a very specific science. Most of us don't know about disability management and the legalities and liabilities that are involved until we get into this world. So it is very nuanced. It is very specific. So it's nice to have somebody, and it's important. Actually, it's not even just nice. It's important to have somebody who's worked in all of these different worlds, understands the employer's perspective, the employee's perspective that's returning to work, the treatment providers, and then also the legislation on duty to accommodate and disability management, and be able to pull all of those supports and services and resources and legislation together to make sure that we have the right supports set up for this employee to do well, or to set them up to do as best they can or well enough. So I just wanted to share that, that like the idea of what we do and what's so important to me is that collaboration, the multidisciplinary approach. So you have the medical system, you have the employer, you have maybe some public health, maybe some private health. How do we pull that all together and create a return to work plan that's effective and sustainable? And so it could be through a program like mine that's the mental health ecosystem, but maybe this conversation is also to empower that employee to be able to use the proper language, rely on the proper legislation so they can protect themselves too against discrimination. Because that's really why we want to protect that health information. Yes, there's PIPA, but there's also the possibility, I will say, of like you said, someone not being promoted because maybe others know that they have ADHD and they don't think that they're going to be very organized. Whereas they are very organized and they probably have some really great strategies that they've created to stay organized in their neurodivergence. That's all to say that, in individuals with maybe neurodivergence, it's really, or other mental health disorders, it's really important to know how to communicate I love that strength-based approach that you used earlier, that positive approach. We want to show what we can do versus what we can't do or what we're struggling to do and maybe we might need some extra supports with. We want to focus on that positive because it does protect us against discrimination. I'm just like how we do on a resume, just like how we do in a job interview. We want to put our best foot forward. We want to shine ourselves in a positive light. I've been off work and I come back to you with all of this knowledge and self-awareness and strong sense of self that's so important to know who I am, to stand my ground, to make critical decisions, to take those risks in the workplace. Because those that are feeling good enough to take those risks and challenge themselves and be safe enough, that term that I used earlier, those are the employees that do so well, that grow our companies, that help us or challenge us to reflect on what we're doing well, or maybe where there's some gaps in services. We need employees to feel like that. And it's, in a way, it is a strength taking that time away and coming back. So I think in communication, as an employee or with our providers, really setting our best foot forward and knowing ourselves, being self-reflective, knowing ourselves well enough to set up supports to say, this is how I'm going to do well. This is my plan for doing well. How can you support me in this? And taking that strength, taking that confidence. Because we have heard, in different times, there is that guilt for going off work. What team am I leaving behind? What extra work might I be leaving for them? Well, you need to do this, and it's more important for you to be around and you to be well than to support your team, because that's not working for you right now. So when I go back to work, that guilt, maybe that shame, that anxiety, really that strong sense of self and that confidence, establishing that during our treatment and time off, really helps us to come back as a stronger person, happier person, better quality of life, and also a better employee, right? Happy employees, well employees, confident, high self-esteem employees, we do well when we know ourselves, right? We do well and we are actually the best resource in the workplace.
I love that. That's fantastic.
Thanks. Thanks. I know I have this big smile on my face because when I was doing job development, everyone who walked through our door, who sat down at my desk, I wanted them to know that, healthy workplaces do exist, and you can feel so fulfilled in your workplace just by knowing yourself, knowing what works for you, what work environment works for you or not, and what type of people you want to work with. What's important to you, and how can we support that? And I felt that part of myself come through when I was speaking there. Kind of like one of those glory moments that if only I could tell everyone in the world how happy they could be, and set that up for them, help create that scenario for them. That would be great. That's all that we aim to do in my program, I should say. All we aim to do in my program.
That's amazing. Christina, thank you so, so much. To learn more about that program and the work you do, and where can people learn more and find you?
Well, they can find me on LinkedIn. That would be a great place to connect. I like to post my thoughts and share different things that we're doing or different questions that we're putting out there to the community. But the Acclaim website would be Acclaim Ability Management would be the best place to find me, to learn more about my program, or even just to have a thoughtful discussion on how we can improve the workplace, how we can improve communication and relationships amongst employers and employees, and really promote wellness. It's
We'll
been a
link all of
pleasure.
It
Thank
has
you.
been a pleasure. We'll link all of that in the description below this episode. And yeah, I can't wait to have more discussions with you in the future, Christina. This was really, really fantastic to listen to even more episodes. We're going to cover lots more topics. I want to cover this one some more too. Check it
Same,
out.
I could talk forever about this.
Check it out on Spotify or Apple Podcasts. And Christina, thank you so much, and we'll see you next time.
Thanks so much, Jonathan. You take care.